also pledged their commitment to ensuring all people can access life-saving tools for COVID-19, accelerating development of the products, but at the same time, access to all. Recent advances in science are enabling the world to move at incredible speed to develop these tools. But the true measure of success will not only be how fast we can develop safe and effective tools, it will be how equally we can distribute them. None of us can accept a world in which some people are protected while others are not. Everybody should be protected. None of us are safe until all of us are safe. The potential for continued waves of infection of COVID-19 across the globe demands that every single person on the planet be protected from this disease. WHO remains committed to working with all countries and partners to accelerate the development and production of vaccines, diagnostics, and therapeutics, and to ensure their equitable distribution. This is an opportunity for the world to come together to confront a common threat, but also to forge a common future. A future in which all people enjoy the right to the highest attainable standard of health and the products that deliver that right. That's what we mean by health for all. We have been saying it for the last more than 70 years since the WHO was created. But I think, given the experience we have now and the difficulties we're going through, it's time to make it happen, health for all. But one of the best tools is also one of the most basic: clean hands. The simple act of cleaning hands can be the difference between life and death, and remains one of the most important public health measures for protecting individuals, families, and communities against COVID-19 and many other diseases. Tomorrow is Hand Hygiene Day, a reminder of the importance of clean hands for health workers and for all of us. At the same time, we must remember that millions of people around the world are not able to practice this most basic of precautions. Around the world, less than 2/3 of healthcare facilities are equipped with hand hygiene stations, and 3 billion people lack soap and water at home. This is an old problem that requires new and vastly increased attention. If we are to stop COVID-19 or any other source of infection and keep health workers safe, we must dramatically increase investments in soap, access to water, and alcohol-based hand rubs. Tomorrow also marks the International Day of the Midwife. This is an opportunity to remember the vital role that midwives play all over the world in providing safe and effective care for women and newborns. Research shows that interventions delivered by midwives can avert over 80% of all maternal deaths, stillbirths, and neonatal deaths. The service of midwives is actually a lifeline for many. Childbirth can be one of the most precious moments in a woman's life, but it can also be one of the most dangerous, as you know. Midwives are essential for guiding and caring for women through their entire pregnancy and the critical moment of childbirth. But we need more midwives in all countries, especially low-resource countries. To mark Hand Hygiene Day and the International Day of the Midwife, we're calling all people to stop what they're doing at noon tomorrow to clap for nurses and midwives and thank them for their role in delivering safe and effective care, especially during this pandemic. They're risking their life and to protect or to give life to others. Several countries are now starting to ease so-called lockdown and stay-at-home orders. But our common commitment to basic measures such as cleaning hands and physical distancing cannot be relaxed. Nor can the commitment to the tools that are the foundation of the response to find, isolate, test, and care for every case and trace every contact, and to ensure health systems have the capacity they need to provide safe and effective care for all. But just as the number of new cases and deaths is declining in some countries, it's mounting in others. That's why today's pledging event is so important. This virus will be with us for a long time, and we must come together to develop and share the tools to defeat it. But of course, today's event only covers one part of the response. For research and development in vaccines, diagnostics, and therapeutics. In the weeks and months ahead, we will need much more to meet the demand for personal protective equipment, medical oxygen, and other essential supplies. Later this week, WHO will launch its updated strategic preparedness and response plan, which will provide an update of the resources WHO needs to support the international response and international and national action plans to the end of 2020. WHO is grateful to the many countries and donors who supported the first strategic and response preparedness and response plan. And we are also grateful to the more than 300,000 individuals, corporations, and foundations who have contributed to the Solidarity Response Fund, which has generated more than $210 million in just 6 weeks. As my friend Boris Johnson said during today's pledging event, we're in this together, and together we will prevail. We will prevail through national unity and global solidarity. The antidotes to this virus are national unity and global solidarity. The antidote to this virus is the human spirit. Thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We will now open the floor for questions. I will remind journalists to be very brief and ask only one question, so we can try to take as many as possible. And again, you can ask the question in 6 UN languages plus Portuguese. For journalists who are on Zoom, you will need to go to settings to find your language. And for speakers of a bug we have, Arabic is under Korean. So if you want to listen in Arabic, you have to click on Korean. That's a bug that we have in a Zoom, and it's not really our fault. We will start with EFE news agency. Isabel is online. Isabel?
Yes, do you hear me?
Yes.
Thank you. Ya, gracias. Voy a hacer la pregunta.
Yes, I'm going to ask the question in Spanish. Thank you for taking this question. In several countries in various regions, some in Latin America, pharmacies are selling diagnostic tests for coronavirus so that people can carry out the test at home. And in some countries, it's being done with authorization from the health authorities, and in other countries, it's more or less informal. And I'd like to know if the WHO advises that people carry out their own self-testing, if they think that these tests are reliable, and if what they see is the risk that someone with a false negative result, if the tests are not reliable, and so someone could think that they are healthy and could then transmit the virus further, since lockdown measures are starting to be relaxed in many countries.
Thank you for the question. So there are a number of diagnostic tests that are currently available and are being sold globally. In fact, there's hundreds of them. And the tests that you're referring to are these molecular tests, or these PCR-based tests that can diagnose somebody as having active infection. It's difficult to answer that question because I don't know exactly which tests you're referring to. What is really important is that the tests that are being used by any governments or being sold, that there's clear results of how well these tests work. There are the possibilities that if they are not validated, we call validated, where we test them against known samples of whether the samples are indeed positive or negative. It's very difficult to know if the test result that you're getting is a true result. And as you've highlighted, there are risks associated with having a false positive in thinking that you are infected and you are indeed not. And more importantly, if you test false negative, where in fact you are infected and the test tells you that you're not. So there are some risks associated with being sold over the counter. Having said that, the ingenuity, the rapid development of these tests is very positive, and we welcome this innovation. We welcome the speed at which these tests are being made available, but it is important that they're validated. It's important that we really understand how well they work. Bottom line, though, is that everyone that is out there needs to adhere to public health measures regardless. These include hand hygiene that the DG has just mentioned, and you've heard us mention well, with washing your hands with soap and water or an alcohol-based rub. Practice physical distancing, so where you're physically distant from another person. Adhering to the public health measures that are put in place by governments. Practicing respiratory etiquette. These are the things that must be adhered to all the time while we work through the use of some of these tests that are coming online.
Thank you very much, Dr. Van Kerkhove. Hope this answers the question from Isabel, and it was on self-testing. Next question is from Joan from Meetings Today. Joan, can you hear us? Joan, can you unmute yourself, please?
Sorry, I did.
Okay,
Thank you. Hear me now. Thank you. Meetings and conventions are part of the tour and travel industry, and we are incredibly confused about how WHO classifies mass gatherings. Around the world and in the U.S., groups don't know what that means. We're finding different standards within the United States, and I just saw someone mention what France is doing in terms of the ability to travel to meetings. We need guidelines about how WHO defines mass gathering and how we're going to go forward. Thank you.
So thank you for the question. I will start, maybe Mike would like to supplement. So the question around mass gatherings, there's different ways in which people are defining gatherings, just gatherings in general, in terms of, you've seen different governments put in place more than 5 people, no more than 10 people, no more than 50 people. Mass gatherings are obviously much larger than that. What we do is we have put out guidance which provides a risk assessment-based approach that evaluates each gathering as it is defined, as it is developed. What is the gathering itself? Where is it taking place? How many people are involved in it? Is there any way in which it can be done remotely or through video? Is there a way it can be postponed? And so what we're trying to do is lay out the criteria in which those decisions can be made. Those decisions must be made on a case-by-case basis because not all situations are the same. The area in which they are carried out have different ventilations. Some are outdoors, some are indoors. So it depends.